Welcome, students, to today's lecture on familial glucocorticoid deficiency type 1, a rare genetic disorder affecting the adrenal glands. In this comprehensive session, we will delve into the molecular basis, clinical manifestations, diagnostic approaches, management strategies, and long-term complications associated with this condition. We will also explore the psychosocial impact of familial glucocorticoid deficiency type 1 and engage in case-based discussions to sharpen your critical thinking skills. So, let us embark on this journey through the intricate world of adrenal dysfunction. Familial glucocorticoid deficiency type 1 is primarily caused by mutations in the melanocortin-2 receptor, MC2R, melanocortin-2 receptor accessory protein, MRAP, and melanocortin-2 receptor accessory protein 2, MRAP2, genes. These genes play a crucial role in the regulation of cortisol synthesis and secretion in the adrenal glands. The analysis of specific mutations in these genes provides valuable insights into the pathogenesis of familial glucocorticoid deficiency type 1 and helps in understanding the impact of these mutations on adrenal function. To comprehend the pathophysiology of familial glucocorticoid deficiency type 1, we must first examine the intricate signaling pathways involved in the hypothalamus-pituitary-adrenal (HPA) axis. The HPA axis constitutes a complex network of interactions between the hypothalamus, pituitary gland, and adrenal glands, orchestrating the synthesis, secretion, and regulation of cortisol. Detailed examination of these signaling pathways will enhance our understanding of the dysregulation observed in familial glucocorticoid deficiency type 1. The defective production of steroid hormones is a hallmark of familial glucocorticoid deficiency type 1. Dysfunction in various enzymatic steps, including cholesterol transport, conversion of cholesterol to pregnenolone, and subsequent conversion to cortisol, contributes to impaired adrenal steroidogenesis. The consequences of defective steroid hormone production extend beyond the adrenal glands and affect various body systems, including the immune, cardiovascular, and skeletal systems. In-depth exploration of these consequences is crucial for comprehending the wide-ranging impact of familial glucocorticoid deficiency type 1. The clinical presentation of familial glucocorticoid deficiency type 1 is highly diverse, making its diagnosis challenging. Symptoms such as hypoglycemia, failure to thrive, salt wasting, and hyperpigmentation may mimic other adrenal disorders. Consequently, a comprehensive analysis and understanding of the clinical manifestations and diagnostic approaches, including the use of ACT stimulation tests, is essential to differentiate familial glucocorticoid deficiency type 1 from similar conditions. In this segment, we will engage in a comparative evaluation of familial glucocorticoid deficiency type 1 with other adrenal disorders, namely congenital adrenal hyperplasia and Addison's disease. Understanding the subtle differences in clinical presentation, genetic basis, and biochemical profiles will aid in accurate diagnosis and appropriate management. The identification of familial glucocorticoid deficiency type 1 in an affected individual raises ethical considerations for genetic counseling and family planning. Understanding the inheritance patterns, risk assessment, and implications for carriers and prospective pregnancies is crucial to providing comprehensive patient care and guidance. Hormone replacement therapy forms the cornerstone of managing familial glucocorticoid deficiency type 1. Adequate replacement of cortisol and mineralocorticoid hormones is crucial to maintain physiological homeostasis. Regular monitoring of adrenal function, including biochemical markers and imaging studies, is necessary to optimize therapy and prevent complications. Adrenal crisis is a life-threatening emergency that can occur in individuals with familial glucocorticoid deficiency type 1. Triggers such as illness, trauma, or certain medications can precipitate adrenal crisis. Detailed knowledge of the clinical presentation, emergency management, and preventive measures is essential to ensure timely intervention and mitigate the risk of adrenal crisis. Beyond the immediate consequences of adrenal insufficiency, familial glucocorticoid deficiency type 1 can lead to long-term complications. Growth and developmental delays, skeletal abnormalities, metabolic disturbances, and impaired fertility are among the challenges that patients may face. Investigating these complications will provide a holistic approach to patient care. Emerging treatments, such as gene therapy and novel pharmacological interventions, hold promise for individuals with familial glucocorticoid deficiency type 1. This segment will examine recent developments in the field and their potential impact on future management strategies. The impact of familial glucocorticoid deficiency type 1 extends beyond the physical realm. Patients may experience psychological distress, impaired quality of life, and challenges in maintaining social support networks. Understanding the psychosocial aspects of this condition will enable us to provide comprehensive care and support to affected individuals. To further enhance your clinical reasoning and critical thinking abilities, we will engage in interactive case-based discussions. By analyzing real-life cases, we will navigate through the complexities of familial glucocorticoid deficiency type 1, exploring diagnostic dilemmas, treatment decisions, and management challenges. In summary, familial glucocorticoid deficiency 1 presents complex challenges that require a deep understanding of its genetic, molecular, and clinical aspects. As future medical professionals, it is crucial to stay informed and committed to improving the lives of those affected by this rare disorder.